We could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
We have known about CAPS-like viruses in animals and people for decades, but have not been successful at developing a licensed vaccine. And sure, there are new technologies that may help, but it's going to be difficult. I am not optimistic about having a vaccine in time to be relevant during this pandemic.
So the policy crisis in question for this board in this meeting is this: how should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most?
What we've seen work very well in the HIV field is, in fact, procurement through the Global Fund. So having a centralized mechanism, so financially able to procure on behalf of affected countries would be critical. I think the second thing is it's going to be
Welcome to Event 201.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. At first, the spread was limited to those with close contacts, healthcare personnel, co-workers, and families. But now, it's spreading rapidly throughout local communities. International travel has turned local epidemics into a pandemic spanning the globe. Just 3 months ago, CAPS started in South America, but has now reached several countries with more than 30,000 cases and nearly 2,000 deaths.
And the resulting chaos.
CAPS is a novel coronavirus related to those viruses that caused the frightening SARS epidemic in 2003 and the deadly MERS outbreaks in recent years. Scientists think each infected person in turn infects on average 2 more people. This disease is proving more transmissible than SARS or MERS and about as contagious as influenza. Essentially, the cumulative number of cases is doubling every week. At this rate, we can expect to see 16 times as many cases in a month unless we find a way to interrupt transmission. The virus appears to be spreading rapidly in densely populated and impoverished neighborhoods in some megacities in South America. CAPS is a serious respiratory disease. More than half of the recognized cases have required hospital care, creating a huge strain on healthcare systems. The fatality rate is about 10%. For comparison, CAPS is about as lethal as SARS and 2 to 4 times more lethal than the 1918 influenza pandemic, the worst pandemic on record. Even so, some people only exhibit mild flu-like symptoms, not requiring treatment in a hospital. Alarmingly, those people are able to walk around and spread the virus, not realizing they are doing so. Even worse, international travelers have been arriving at their destinations symptom-free, but within a matter of hours, becoming ill. Travel-related cases have blossomed into outbreaks in a number of locations and have quickly grown faster than health authorities could respond and contain them. In other places, physicians have quickly recognized the symptoms of CAPS and have been able to isolate infected individuals and avoid an outbreak, for now. Global public health experts are very concerned about this disease because it appears the virus is readily transmitted through the air from person to person. Essentially, all people are susceptible. Experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
As we've just heard, there is no existing vaccine that appears effective against the newly discovered CAPS virus. Governments, scientists, and companies around the world have become working intensively to develop one, but it's highly unlikely that a vaccine could be developed, tested, manufactured, and distributed in less than a year, and it's likely to take much longer. While there have been efforts to develop vaccines against SARS and MERS coronaviruses, none have been licensed. And given the distinctions in the CAPS virus, vaccines against those diseases would not be effective for CAPS. The antiviral drug Extranavir has demonstrated some efficacy against the CAPS virus. It reduces the severity of illness and saves lives in those who are infected, but does not prevent infection like a vaccine would. Extranavir is a generic drug primarily used to treat HIV. It is manufactured in 5 countries, including the United States and China.
Our U.S. affiliate has just released polling results on public expectations for a vaccine. A majority of Americans expect a vaccine to be available within 2 months, and 65% of those polled are eager to take the vaccine, even if it's experimental. In related news, a significant demand for personal protective equipment like N95 masks and gloves are on the rise due to the pandemic. However, globally, hospitals are running low. Additionally, other critical medical supplies such as saline and antibiotics are dwindling. Countries and companies are reportedly stockpiling supplies, disrupting healthcare supply chains, causing dangerous shortages in many parts of the world.
And finally, for the latest information on what we know about more on this, we're going to get a briefing from our communications expert, Dr. Sell.
Global health experts have highlighted that dis and misinformation are wreaking havoc on the CAPS response. Health workers are under attack in a number of locations due to rumors that they are purposely spreading the disease. And response efforts in many places have had to be suspended because of concerns around violence. Pharmaceutical companies are being accused of introducing the CAPS virus so they can make money on drugs and vaccines, and have seen public faith in their products plummet. Unrest due to false rumors and divisive messaging is rising and is exacerbating spread of the disease as levels of trust fall and people stop cooperating with response efforts. This is a massive problem, one that threatens governments and trusted institutions. Polls have shown that mis and disinformation are ubiquitous. At least 90% of the public has been exposed to these messages. At the same time, misinformation messages come from a variety of sources, even government officials. And often governments are contradicting one another. We know that social media is now the primary way that many people get their news. So interruptions to these platforms could curb the spread of misinformation, but could also limit access to information from legitimate sources. Health ministries around the world are attempting to combat mis and disinformation by amplifying public health messaging through social and traditional media. But they are being outpaced by false and misleading information. National governments are considering or have already implemented a range of interventions to combat misinformation. Some governments have taken control of national access to the internet. Others are censoring websites and social media content. And a small number have shut down internet access completely to prevent the spread of misinformation. Penalties have been put in place for spreading harmful falsehoods, including arrests. Other countries have taken a more moderate approach and have focused on promoting fact-checking efforts and working with traditional media outlets, yet these approaches are limited in scope. Social media companies report that they're doing all they can to limit the use of their platforms for nefarious or misleading purposes. But this is a technically difficult problem, and false, misleading, or half-true information is difficult to sort without limiting potentially true messages. The bottom line is that members of the public no longer know who to trust. Both the misinformation and the measures to control it have led to a crisis of confidence.
The outcome of the CAPS pandemic in Event 201 was catastrophic. 65 million people died in the first 18 months. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities. From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. At first, wealthy countries with advanced healthcare and public health systems were primarily able to limit the spread of the disease within their borders. As systems became overwhelmed, however, no countries were able to control its spread. And the disease affected people of all socioeconomic status, from the very poor to the extremely rich, from sanitation workers to CEOs and national leaders. The economic consequences were dramatic. The high death toll and even greater numbers of sick hurt productivity in many industries. Manufacturers were having trouble filling orders, and countless companies in the service sector simply shut down. The global economy was in a free fall. The GDP down 11%. Stock markets around the world plummeted between 20 and 40% and headed into a downward cycle of fear and low expectation. Businesses were not borrowing, banks were not lending. Everyone was just hoping to hunker down and weather the storm. While nearly all businesses were affected, certain sectors were especially hard hit. Travel, finance, service, manufacturing, healthcare, and insurance among them, with some major companies going bankrupt. And there were seismic societal consequences as well. The world saw large-scale protests and in some places riots. People were angry about the lack of access to healthcare and medicine, as well as governments' inability to protect them from the disease. This led to violent crackdowns in some countries and even martial law. Political upheaval became the rule across the globe. The public lost trust in their respective administrations. Several governments fell, while others were desperately striving to hold on to power. This spurred further crackdowns. Attempts to control media messaging, originally aimed only at health-related misinformation, became used increasingly to quash political dissent. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer. We have to ask, did this need to be so bad? Are there things we could have done in the 5 to 10 years leading up to the pandemic that would have lessened the catastrophic consequences? We believe the answer is yes. So, are we as a global community now finally ready to do the hard work needed to prepare for the next pandemic?